Unsettling news about drug overdoses among children in the United States. A new study says the rate of children hospitalized for prescription opioid overdoses and poisonings doubled from 1996 to 2012. Joining us with more on this public health crisis is WSJ Health and Science Deputy Bureau Chief Gene Whalen. Welcome, Gene. This is certainly daunting news, and it seems that toddlers ages 1 to 4 are particularly at risk.
That's right. Yeah, the study showed that among that age group, the toddlers, the rate grew even more over the 12 years of the 16 years of the study. And they speculate that those children were probably getting into their parents' medications, either finding them on the floor or parents maybe leaving them out. And
it's my understanding that their rate of hospitalization more than tripled during the 16-year period.
That's study. Right, between 1997 to 2012. So very sad.
Very sad indeed. And then looking at teenagers ages 15 to 19, the death rate among teenagers in that age group nearly tripled?
Sorry, no, that was the hospitalization rate.
Hospitalization rate.
Yep.
Okay, sorry.
Among teens. So, so the study looked at hospitalizations for all of these age groups. And among the teens, the rate was also quite high, teens 15 to 19. And that's probably due to either accidental or intentional overdoses, possible suicide attempts or misusing the opioids, abusing them, and overdosing.
Likely getting into their parents' medicine cabinets.
Yeah, yes, probably in some cases they may have been prescribed the medications themselves, or they may have bought them on the black market.
And we know also that the use of heroin among teenagers is increasing. Can that be linked to an earlier opioid use?
Yeah, often that is the way the problem evolves, that the person starts out taking a prescription medication that they were either prescribed or that they bought on the black market, and then they progress to heroin because heroin acts in a very similar way in the brain and is often cheaper.
Absolutely. Sadly. Now, looking towards the end of this study, I know it ended in 2012, were the researchers able to sort of intuit that perhaps prescriptions were becoming a little less liberal?
Right. So the study showed that in the final few years, right up to 2012, the rate of hospitalizations declined a little bit among the children studied, and they suspect that's because doctors were starting to prescribe less. They were beginning to become aware that this was a huge problem.
And I mean, it certainly is. I mean, among adults, the abuse of opioids, including painkillers, heroin, fentanyl, has become a major public health crisis. I mean, according to the CDC, I guess opioids were the most common cause of the nation's 47,000 drug overdose deaths in 2014.
That's right, and that was more than car accidents in 2014. We're waiting to hear the 2015 numbers now, which should come out pretty soon.
So I guess if this continues to be obviously an epidemic among adults, it almost makes a sad sort of sense that it's bleeding down to the children.
It really does, but the children have been less studied, so this is sort of one of the first studies to show the hospitalization rate among kids.
And what are the recommendations from this study?
They would like to see more investment in obviously in prevention and getting kids to not abuse the drugs in the first place, and getting parents to store them more safely, perhaps safer bottling, all sorts of measures.
Could we be seeing some public health announcements around bottling up your opioids?
I certainly hope
walking
so.
them away.
There has been quite a lot of that in recent years, so hopefully that is making a difference, but there could always stand to be more, definitely.
Gene Whalen, thank you so much for that.